Got it all wrong.
Mr. Trumbull's under arrest for a felony.
Excuse me, I'm Mrs. Trumbull. Do you know where my husband is?
In the booking room, right over there.
Just empty your pockets, please,
I
sir.
was with my daughter.
Are you all right?
Sir, can I have your business address, please?
Yeah, 2107 Doral in Glendale.
Stand still, sir. Face front. Thank you.
All right, right this way, sir. So, Joe, would you call my wife to the mobile late?
Yeah.
Give your right thumb.
It's very embarrassing. I've never been in trouble in my
Index
life.
finger, please.
You're allowed one telephone call. If you wish to call your attorney, you may.
Your Dick's
Is it
number.
home? I'll call
Right this way, sir.
Yes, please call him.
I will.
Okay, let's go.
Now need your belt and your shoes.
Why? There must be some kind of a mistake, officer. I'm not a criminal.
In here.
It was an accident. I didn't mean to start a fire.
If you or your family, or your loved one, or someone are been facing some serious criminal charges, it will cost you a lot of money, and even worse, someone or somebody are gonna pay for that damage. Don't let this happen to you. This is the time you need a lawyer on your side today. Call 1-800-CRIMINAL or go to 1-800-CRIMINAL.com for more information. Because you need all the help you can give. That's 1-800-CRIMINAL. Call now, a law firm that is partnership with PBS Kids.
What is Stelara, ustekinumab? Stelara is a prescription medicine used to treat adults and children 6 years and older with moderate to severe psoriasis who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet light alone or with pills. Adults and children 6 years and older with active psoriatic arthritis. Adults 18 years and older with moderately to severely active Crohn's disease. Adults 18 years and older with moderately to severely active ulcerative colitis. Important safety information. Stelara is a prescription medicine that affects your immune system. Stelara can increase your chance of having serious side effects, including serious infections. Stelara may lower your ability to fight infections and may increase your risk of infections. While taking Stelara, some people have serious infections which may require hospitalization, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Your doctor should check you for TB before starting Stelara and watch you closely for signs and symptoms of TB during treatment with Stelara. If your doctor feels that you are at risk for TB, you may be treated for TB before and during treatment with Stelara. You should not start taking Stelara if you have any kind of infection unless your doctor says it is okay. Before starting Stelara, tell your doctor if you think you have an infection or have symptoms of an infection such as fever, sweats, or chills, muscle aches, cough, shortness of breath, blood and phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinate more often than normal, feel very tired, are being treated for an infection or have any open cuts, get a lot of infections or have infections that keep coming back, have TB, or have been in close contact with someone with TB. After starting Stelara, call your doctor right away if you have any symptoms of an infection, see above. These may be signs of infections such as chest infections or skin infections or shingles that could have serious complications. Stelara can make you more likely to get infections or make an infection that you have worse. People who have a genetic problem where the body does not make any of the proteins interleukin-12, IL-12, and interleukin-23, IL-23, are at a higher risk for certain serious infections that can spread throughout the body and cause death. People who take Stelara may also be more likely to get these infections. Cancers. Stelara may decrease the activity of your immune system and increase your risk for certain types of cancer. Tell your doctor if you have ever had any type of cancer. Some people who had risk factors for skin cancer developed certain types of skin cancers while receiving Stelara. Tell your doctor if you have any new skin growths. Posterior reversible encephalopathy syndrome, PRES. PRES is a rare condition that affects the brain and can cause death. The cause of PRES is not known. If PRES is found early and treated, most people recover. Tell your doctor right away if you have any new or worsening medical problems, including headache, seizures, confusion, and vision problems. Serious allergic reactions. Serious allergic reactions can occur. Stop using Stelara and get medical help right away if you have any symptoms of a serious allergic reaction, such as feeling faint, swelling of your face, eyelids, tongue, or throat, chest tightness, or skin rash. Lung inflammation. Cases of lung inflammation have happened in some people who receive Stelara and may be serious. These lung problems may need to be treated in a hospital. Tell your doctor right away if you develop shortness of breath or a cough that doesn't go away during treatment with Stelara. Before receiving Stelara, tell your doctor about all of your medical conditions, including if you have any of the conditions or symptoms listed above for serious infections, cancers, or PRES. Ever had an allergic reaction to Stelara or any of its ingredients? Ask your doctor if you are not sure. Are allergic to latex? The needle cover on the pre-filled syringe contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Stelara should not receive live vaccines. Tell your doctor if anyone in your house needs a live vaccine. The viruses used in some types of live vaccines can spread to people with a weakened immune system and can cause serious problems. You should not receive the BCG vaccine during the 1 year before receiving Stelara or 1 year after you stop receiving Stelara. Have any new or changing lesions within psoriasis areas or on normal skin. Are receiving or have received allergy shots, especially for serious allergic reactions. Receive or have received phototherapy for your psoriasis. Are pregnant or plan to become pregnant. It is not known if Stelara can harm your unborn baby. You and your doctor should decide if you will receive Stelara. Received Stelara while you were pregnant. It is important that you tell your baby's healthcare provider before any vaccinations are given to your baby. Are breastfeeding or plan to breastfeed. Stelara can pass into your breast milk. Talk to your doctor about the best way to feed your baby if you receive Stelara. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. When prescribed Stelara, use Stelara exactly as your doctor tells you to. Stelara is intended for use under the guidance and supervision of your doctor. In children 6 years and older, it is recommended that Stelara be administered by a healthcare provider. If your doctor decides that you or a caregiver may give your injections of Stelara at home, you should receive training on the right way to prepare and inject Stelara. Your doctor will determine the right dose of Stelara for you, the amount for each injection, and how often you should receive it. Do not try to inject Stelara yourself until you or your caregiver have been shown how to inject Stelara by your doctor or nurse. Common side effects of Stelara include nasal congestion, sore throat and runny nose, upper respiratory infections, fever, headache, tiredness, itching, nausea and vomiting, redness at the injection site, vaginal yeast infections, urinary tract infections, sinus infection, bronchitis, diarrhea, stomach pain, and joint pain. These are not all of the possible side effects with Stelara. Tell your doctor about any side effect that you experience. Ask your doctor or pharmacist for more information. Please read the full prescribing information and medication guide for Stelara and discuss any questions you have with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.